Hello, and welcome to the BBJ's 2021 Leaders in Healthcare event. I'm Rhonda Pringle, Market President and Publisher of the Baltimore Business Journal. We're grateful that you've joined us this morning to help us recognize this year's Leaders in Healthcare. Now in its third year, our Leaders in Healthcare Awards honors the individuals going above and beyond to make a positive impact on Greater Baltimore's healthcare industry and the communities they serve. Today, we are pleased to celebrate 11 outstanding leaders in healthcare, whose work is not only ensuring a healthier Baltimore, but whose commitment to underserved communities is contributing to better and more equitable healthcare outcomes. During today's program, we'll be joined by 3 local healthcare professionals who will sit down with BBJ reporters to discuss what the year's been like for them and what the future of healthcare holds. Before we get started, I would like to thank celebration sponsors Kennedy Krieger Institute, LifeBridge Health, and University of Maryland School of Medicine. Contributing sponsor DuckPen, and our awards partner, Allogram. Please feel free to show your support of the honorees by sharing your congratulations via our question panel. And don't forget to download the event program from the handouts panel. Now let's turn it over to BBJ's Editor-in-Chief, Joanna Sullivan, for her Fireside Chat with Kneuzil, Director of the Center for Vaccine Development and Global Health. Joanna?
Thank you, Rhonda. I was lucky enough to sit down and talk to Kneuzil last month before the Omicron variant became widely known. Here's our conversation. I'm here with Dr. Kneuzil. To say vaccines have been in the news is a major understatement, and our next guest has been on the forefront of vaccine research during the pandemic. Please welcome Dr. Kneuzil, Professor in Vaccinology and Director of the University of Maryland School of Medicine Center for Vaccine Development and Global Health.
Thank you. I'm happy to be here.
So I was wondering, to start out, I can't even imagine what you've been through the last couple of years. Can you describe what it's been like to be on the forefront of vaccine research?
Sure. It's been an interesting couple of years, to say the least. I was thinking back to the end of 2019, which is, I think, the last normal that most of us had. And my usual life and our usual life here, we did a lot of global health work. We did a lot of vaccine work. I was traveling internationally once or twice a month right up through January of 2020, and very clearly remember hearing the first news reports of an outbreak of a respiratory disease in China at the end of 2019, some very early phone calls with NIH and others at the beginning of 2020, and then really just life-changing very quickly as vaccine development accelerated. In many ways, our lives in this business got busier as everything in society was slowly shutting down over that March, April, May time period of 2020.
Did you ever imagine that a vaccine would be developed so quickly for COVID-19?
No, I would say when I look back at interviews I gave and people I talked with, many of us were saying best case scenario, 12 to 18 months, best case scenario. And really we hit it in under 12 months. And it was a joy for me personally. I received my first dose of vaccine on December 31st, 2020, and was really just so moved that I could get a vaccine in the same year that a pandemic had been declared.
Did you ever think that a vaccine, would become so controversial and so political?
I have to say that part of it has really surprised me. We have definitely seen an increase in vaccine hesitancy. We had seen an increase in the anti-vaccine movement over years. And there were some vaccines, the HPV vaccine, for example, that were more targets than other vaccines. What was surprising to me is that in the face of a pandemic, where, from my view, the need was so great and so obvious, and where it was quite literally affecting every single person's life, I was surprised under those circumstances to see the pushback that we have seen.
Have you personally received any pushback?
I have received pushback. I think it's hard to find anyone in this business, particularly with social media, particularly with how much we have been out there, on TV, on the radio, in the newspapers. I haven't received any threats that were credible in any way. I've certainly received, email and comments on Twitter and other social media pages. But we have had people, others on our faculty who have received personal threats about what they have said or done.
That's very scary.
Yeah, it really is scary. And again, the political nature of it is concerning, because we always operated from the standpoint that, public health should not be politicized. We are doing this for the greater good, in the same way we have traffic safety for the greater public health good. And so the politicization of this has been surprising.
Is there any way to convince vaccine hesitant people that it's safe to take the vaccine?
Yeah, we have learned from other vaccines some tactics that work. The message needs to be simple and consistent. And in some ways, that was difficult during an evolving pandemic, right? Because we were learning it as we go. The messenger is certainly important. And here is where I think we rely on our leaders and our politicians to step forward. There are many other examples where, Elvis Presley or President of the United States has stepped forward to be one of the first to receive a vaccine. And then that really instills confidence in the public. So the messenger really matters. People trust their own physicians. They trust their own pediatricians. So I really made it a point for me personally that if I was asked by a professional group or a physician group or a nursing group to speak to them on these vaccines or educate them, I would do that, because I knew it wasn't going to be my voice, but it was going to be the other trusted voices that were going to help us here. One aspect that has really been different is in the past, we've really looked at vaccine hesitancy as not having enough information, right? We weren't conveying well enough that the disease was bad and the vaccine was good, and we needed to get information to people. What we've learned in 2021 is we really believe that much of the problem is stemming from too much information. People are getting inundated with information, some of which is credible, some of which is not. It's extremely difficult for the average person to sort through this onslaught of information. So it's been a very different situation than what we're used to dealing with, right? Which is not enough information for people. We've had too much information that we're throwing at people.
So what's next for you in the Center for Vaccine Development and Global Health? What did you learn from the pandemic that will help us battle viruses in the future?
Yeah, it's a really good question. There are three areas where we really benefited, meaning we as a country and a global society. One is that we were able to have vaccines so quickly because of investments in science and technology. That mRNA technology took 3 decades to get to the point where we were able to capitalize on it and have a vaccine within 11 months. The specific technology in understanding this SARS-CoV-2 virus, this coronavirus, was because we had SARS-1 and we had Middle Eastern respiratory virus, and we had scientists who were funded to study and understand these viruses. The networks that I talked about couldn't have been set up overnight. We had existing networks funded by the NIH and the US government that allowed us to pivot quickly. So I have talked to, given congressional testimony, I have spoken to my politicians. I have made the case that we need to continue investing in science, in technology, in these pandemic preparedness efforts that absolutely paid off, but could pay off even further in the future. I think similarly for our Center of Vaccine Development on a smaller scale, it's because we had done this type of work, again, that we were able to pivot very quickly to the pandemic work. In some ways, we were lucky this was a coronavirus that had been studied. There are other viruses around the world that we do not know and understand as well as we understood coronaviruses. And so again, those investments in basic science are going to be fundamental. Where we didn't do as well was with global equity. And this is a pandemic, and we are at risk here in the United States if people aren't vaccinated in Africa and Southeast Asia, because we've seen variants emerge, and this is an infectious disease. It cannot be isolated. It's very clear that this could not be isolated, that it spread very quickly. So we need to make investments in vaccine manufacturing and technology and science in other countries. It's going to take more global infrastructure to be able to respond both to this current pandemic, which isn't over, but also to the next pandemic.
So will it ever truly be over?
That's a good question. I'm one of the believers that this coronavirus is going to become a seasonal coronavirus, and it'll be with us in some way. The definition of a pandemic is that it's transmissible from person to person, which we have seen, that it's new, and that not a lot of the population has immunity. But the third factor is that it causes severe disease. So if through vaccines, we can prevent infection or take a severe infection and turn it into a common cold, and we have most of the globe populated, then coronavirus hopefully will become like many other respiratory viruses that cause infection every year. I also think we're going to learn a lot. We saw not only coronavirus contained with some of our masking and better air filtration and social distancing, but we saw influenza, a virus that I've studied my whole career, practically disappear. And so we've learned a lot. I think we're going to need to pay attention to, certainly in the medical system, we will be wearing masks more. We will be wearing different masks than we used to wear. We have air filtration systems outside in our shared spaces. We are upgrading air filtration systems in hospitals. And we're likely going to have to do that in schools and in businesses. And so there's also a lot we learned outside of vaccines that will help us control these airborne viruses.
It's been nice not to have a cold for 2 years, right?
I haven't had a cold for 2 years. Again, I used to travel all the time. I would lose my voice reliably from a para-influenza infection every year. I have not had a cold for 2 years. So it's really remarkable. Now, again, for a cold, do you close society down? Well, probably not. However, I think there's some middle ground here that will be helpful for coronavirus, but also helpful for these other viruses.
Is there anything else you'd like to add, Kathy?
I would like to say that, again, I made the point in a slightly different way, but this current pandemic is being fueled by the unvaccinated. There's a lot of concentration on, do we need to get a booster dose? When are we going to get better vaccines? How long will they last? It's really the unvaccinated driving the pandemic, though. Here in Maryland, we just heard on the news today that we have more than 90% of our senior population who are vaccinated. That's remarkable. It's the younger and middle-aged adults that aren't stepping forward as well. It's just tremendous now that here before the holidays, we can vaccinate children down to the age of 5. But we still have children under 5, and we still have the immunocompromised, and the rest of us really need to get vaccinated to protect them.
I want to thank you so much, Kathy, for being with us, and look forward to life after the pandemic.
Thank you. It was certainly my pleasure to be here, and I really appreciate you highlighting this public health crisis and the importance of vaccination. Thank you.
Thank you, Kathy and Joanna. And now let's hear from a few of our leaders and healthcare honorees.
The health education category. Dr. Donna L. Parker has been listening for years to students at the University of Maryland School of Medicine. She received her own medical degree there, spent 3 years on the faculty at the University of North Carolina, then returned to Baltimore in 1992. She's now leading efforts that focus on students, including the creation of a Women in Medicine and Science organization. Please congratulate Dr. Donna L. Parker, Senior Associate Dean for Undergraduate Medical Education at the University of Maryland School of Medicine.
Good morning, everyone. It is my honor to accept this prestigious award from the Baltimore Business Journal for my work in educating the next generation of healthcare workers for Greater Baltimore. This work clearly requires a community, so I have others to recognize. First, my medical education team, faculty and staff at the University of Maryland School of Medicine, who have shown tremendous dedication and leadership in educating our students during the challenges of the pandemic. Next, all of the faculty and staff at the School of Medicine who contribute every day and in so many ways to the success of our students. Finally, my achievements would not be possible without the support of Dean E. Albert Reese and Vice Dean James Caper. They have provided invaluable resources and guidance as I've worked to advance the education mission of our school. In accepting this award, I hope to convey the importance of investing in the future. Warren Buffett said, "Someone's sitting in the shade today because someone planted a tree a long time ago." We are all capable of planting trees, and I encourage all of us to take the time to do so by mentoring, sponsoring, and educating our young people to be the change and light we hope for in the future. Thank you.
The medical cannabis category. Ashley Wynn Grimes noticed that when it comes to cannabis medicine, nurses have largely been left on the sidelines. She's hoping to change that with Owings Mills-based Cannabis Nursing Solutions, which she founded to provide cannabis education, consultation, and support. Wynn Grimes is also working on guidelines for handling cannabis conversations in school, something she says is crucial as the industry grows. Please congratulate Ashley Wynn Grimes, founder of Cannabis Nursing Solutions.
Hi, my name is Ashley from Cannabis Nursing Solutions. I just want to give a big thank you to Lee Swinney for nominating me for this award. I am so excited that she did it and she felt that I was deserving of this award. Also to my husband, my girls, M and M, I love you to death. I would not be able to do this without you all. And anybody else who supported me going through all of the trials and tribulations that go into building a small business, Cannabis Nursing Solutions would not be here without you. So just a big thank you. I'm so appreciative right now. I cannot believe that somebody is acknowledging me for work that I'm absolutely dedicated to. And thanks.
The Healthcare Executive Hospital category. Neil Meltzer says the best decision he's made during the pandemic was keeping the focus on caregivers. He says he goes to bed thinking about them and wakes up thinking about them. His dedication to his staff has earned him many accolades as he's worked his way up at one of Baltimore's largest healthcare systems. Please congratulate Neil Meltzer, President and CEO of LifeBridge Health.
Thank you so much. It's truly an honor to be selected as a 2021 Leader in Healthcare by the Baltimore Business Journal. This has been an extraordinary time in healthcare, and I'm humbled to join the group of exemplary individuals who are also recognized this year. I'd like to thank the BBJ for this wonderful recognition and for all they do to keep people in our communities informed in this complex and changing world. I'd also like to thank my family and the teams at LifeBridge Health who are on the front lines caring for our patients in our communities. At LifeBridge Health, we care bravely, and in these extraordinary times, I think we all know what it means to care bravely. The Baltimore Business Journal Leaders in Healthcare event allows us to take just a moment to recognize the people and organizations who care bravely about Baltimore, its people, and our future. Thank you.
Dr. Jacqueline Stone is excited about the advances in telehealth. She sees it as a way to reach many more patients who need her institution's help. Stone said it's another way to help tailor services to each individual child. Please help me congratulate Dr. Jacqueline Stone, Chief Clinical Officer at Kennedy Krieger.
Good morning, everyone. I am honored to receive this recognition today. I am typically one to fly under the radar. I do what needs to be done to ensure we meet the needs of children, youth, and adults with disorders of the nervous system at Kennedy Krieger Institute. I like to continuously work to improve how we partner with our communities. And I enjoy giving back to build the next diverse generation of our workforce. None of this stopped when the pandemic hit Maryland in early 2020. Everyone at Kennedy Krieger mobilized. I mean everyone. Of the 25,000 patients we care for every year, many of them, the majority of them, are served in our outpatient clinics. In March 2020, we needed to quickly determine how to protect everyone's safety and find a way to continue to treat and care for patients because many of those we care for have serious diseases or injuries that require continuous therapies. And we had to act quickly. We soon learned that the populations we served were at the greatest risk for experiencing serious complications from COVID-19. We quickly shifted to telehealth. You see, I'm very lucky. Kennedy Krieger had engaged in 2 small telehealth projects with community providers, and we had experience in our work with deployed military families. This facilitated our quick launch in using telehealth as an outpatient service delivery model. We needed to replicate fast, so we did. We immediately formed a telehealth task force to find a way to quickly pivot to delivering physical therapy, occupational therapy, speech-language pathology, medical therapies, and others, from evaluations to follow-up appointments, to many families who had never used video technology before. We needed laptops for providers. We needed tablets and hotspots for our patients and families, and we needed them fast. What the team accomplished in a few short weeks was nothing short of astonishing. This morning, I am honored yet humbled to be recognized by the BBJ as a leader in healthcare. Humbled because the results that led to this honor resulted in thousands of video-based therapies and appointments being delivered each month, thousands of patients receiving the care they needed. These results were the product of a large interdisciplinary team of committed professionals who often work tirelessly to make it happen. Thank you so much for this honor on behalf of our entire team and Kennedy Krieger. I am tremendously proud of what we've accomplished together and grateful for this recognition.
Congratulations to Dr. Donna L. Parker, Ashley Wynn Grimes, Neil Metzler, and Dr. Jacqueline Stone. Now for our second Fireside Chat of the program, I would like to introduce BBJ Digital Editor Carley Milligan for her discussion with Dr. Redonda Miller, President of Johns Hopkins Hospital.
Hello all, I'm Carley Milligan, Digital Editor at the Baltimore Business Journal, here with Redonda Miller, President of Johns Hopkins Hospital. Hi, Redonda.
Hi, how are you?
I'm doing great. Thank you so much for joining us. Let's just kick it off with, COVID, the hot topic right now, obviously. Now that vaccines are widely available and, much of the population is vaccinated, what is Johns Hopkins Hospital's next step in the fight against the virus?
Well, that's such a great question. And, in my world, it's not clear COVID is certainly near over just yet. So I think our next step, now that we at least have COVID down to a manageable level, we're still wrestling with some of the aftermath. Certainly continuing our mission for discovery, looking at patients who may be suffering from long COVID, thinking through vulnerable populations where there was not vaccine responsiveness. So we're definitely continuing that scientific sort of mission. But I think we've now turned our attention to and thinking about, could there be another pandemic? Maybe it won't be a coronavirus. What do we need to do to be prepared as a hospital and a health system to combat the next pathogen that may emerge? So we're turning a lot of attention to that.
And for those communities that you spoke about that have been more vaccine hesitant, how is Hopkins trying to reach them? What kind of programs or initiatives do you have for that?
We hold vaccine effectiveness at a very high level where we are very wed to the notion that that's going to help us get out of this pandemic. But I understand so many have hesitancy around the unknowns of a novel vaccine and what that could mean. So we've done a lot of work internally with our own staff to try to educate them one-on-one manager sessions to sit down and go through what the concerns are and provide education, bringing vaccine to the work department so they can have access conveniently. But then the broader community at large is where we're also paying a lot of attention. We've partnered with some nonprofits to hold community town halls and just really get education out there, whether it's with the Latino community or NAACP. And then most importantly, we have to make it convenient for local community residents to get the vaccine. So we stood up mobile clinics in schools and rec centers and churches, and those have been wildly successful.
And as you just alluded to, Hopkins is, of course, a community hospital, but you're a nationally renowned institution as well. How are you balancing those two roles?
I think you're right. From our founding, when Mr. Johns Hopkins gave the initial charter to the Board of Trustees, he said exactly what you said. You will be on the cutting edge of science and innovation, but you will be the community hospital for East Baltimore. And honestly, I don't view those two roles as being at all mutually exclusive. Because when you think about what they have in common, it's the patient. And if you drive toward excellence in patient care, you will accomplish both. So certainly on the research front, trying to find the next cures, the next innovative techniques to help people who may travel from all across the country or all across the world. But at the same time, using that innovative approach to improve the health of East Baltimore and make sure we stand ready to treat our neighbor who walks into our emergency department with a diabetic crisis. So I don't think they're mutually exclusive. It's based in that mission.
On the growth side of things, of course, the pandemic has changed how we all talk. We're here meeting virtually today. How have you seen the use of telemedicine within Hopkins change? And do you anticipate making, even further future investments to build out those virtual services?
That is quite the story. I remember pre-COVID, I think as a health system, we did 50, 75 televisits total each month. And with the need to be able to touch our patients remotely, it ramped up literally what was an initial 5-year plan became a 60-day plan. And now at our peak, we hit 90,000 telehealth visits every month. I do think telemedicine is here to stay. I'm so surprised, even my own patients, I still have a practice, and they have embraced it. It's convenient for them. They don't have to drive. They can do it on the spot. So we are continuing to invest in telemedicine. Some of those investments include the IT infrastructure, making sure we have the right platforms so it's easy for patients to connect. And then people think, oh, well, all you need is a button and you can connect with your patient. No, there are still staff that have to help patients connect, that need to make sure the information is logged in correctly and the medications are reconciled, and that the patients know what their aftercare plan is. And then we also have to think about long-term, not just that kind of infrastructure, but
there are certain limitations to telemedicine. For instance, I can't do a physical through the camera. So how do we need to think about, can patients at home use ultrasound guided devices, blood pressure machines, novel ways of transmitting that physical exam information to the doctor through wires? It's exciting.
Yeah. Could something like a wearable tech be used in the future to do that kind of thing?
Absolutely. I think we're going to see, it already started to explode pre-COVID, but now that ability to gather electronic data and information about patients and have them submit it from a distance is really powerful.
To shift gears a little bit here, there's been a lot of reporting about healthcare worker shortages, in particular in nursing and senior care. How is Hopkins helping to kind of grow that pipeline of future healthcare providers?
That pipeline is so crucial as many businesses, not just healthcare, but many businesses across our state are feeling that staffing shortage and the effect it has on morale and ability to deliver services is really potent. So we sort of view it in a couple of different ways. Certainly there's bringing people in the door and growing that pipeline. And that's important. We're starting to expand some of our own internal programs, whether we're training pharmacy techs or surgery techs or CNAs. But also, there are barriers to accessing those training programs. Barriers may include money, tuition. So we're thinking through, how can we enact tuition repayment plans or other ways to remove that barrier? Other barriers, we have local citizens who have been justice involved and can't get that interview. So how do we make sure we can work with some local nonprofits and bring in those patients? So getting them in the door is the first part, I will say. The second part, though, once you have your colleagues inside the door, how do you make sure they're engaged and they feel that commitment to their own personal growth, so they have career ladders before them and can move up the ranks and progress their careers here? So we're investing in that, whether it's coaching or additional training opportunities once you're here, because we think that's really important. Everyone wants to learn and grow.
Fantastic. And so true. I mean, that's why we're here today. So as we're coming to the end of 2021, I can hardly believe it. What do you see as being some of the major topics and issues within the industry of healthcare in 2022?
My gosh. Well, once, as you mentioned, now that we're sort of being able to manage COVID reasonably well, what are the new topics that are emerging? I think we're going to continue to see some issues with staffing, that's for sure. But looking beyond that, I think we have a renewed focus on the patient at the center of all we do. And we can talk about whether we call that consumerism or not, but the bottom line is patients deserve high quality care. They're paying more out of pocket, so we need to focus on keeping our healthcare costs low and in check. And they want convenience. So as I briefly mentioned the telemedicine, making sure that we have community, not just telemedicine, but we are out in the community bringing care to the patient as opposed to having the patient need to drive to us. I also think, in addition to that patient-centered focus, that we're going to be talking a lot more, and have started, believe me, about health equity. There are too many disparities in care and healthcare in our country. We saw that with COVID. We saw a disproportionate number of our patients who were from underserved populations or minorities who had severe disease and deaths beyond what they should have. And so and we know that from other chronic diseases, whether it's heart disease or hypertension or diabetes. So we really need to double down on our efforts to make sure care is equitable.
Absolutely. When you talk about going to the person seeking healthcare, is that something like a mobile clinic, or perhaps having them even come into the workplace, things like that?
When I think about, some of the trends in the market, think about CVS Minute Clinics, think about urgent cares, Walmart hubs, health hubs. People want to be able to get care on demand in a cost-effective manner. And so we need to challenge ourselves as health systems to think about what's going to be our role, what part will we play in that care.
And of course, the pandemic has been such a turbulent time, but are you able to take any silver linings or kind of lessons learned for the future from this?
I'm chuckling just a little bit because last fall around Thanksgiving, I usually send out a Thanksgiving message to the staff. And the message last year focused on double rainbows that I had seen and the silver linings involved. My message today, I think, really goes back to the 3 points I made then. Number one, there are silver linings. Our mission in healthcare is to provide care for patients. It's a noble mission, and you go home every day knowing that you contributed to the good in the world. Number two, the support of our community. Healthcare institutions are nothing without the communities they serve. We saw it during COVID, the parades, the food, the healthcare heroes. So thank whoever's listening for all of that. And then third, the team here at my hospital, and I'm sure every healthcare executive will tell you the same thing, the team here at the Johns Hopkins Hospital were phenomenal. Their ability to redeploy, change gears, work overtime, be here for our patients, made me so proud to work in this environment. So yes, there are many, many silver linings, and hopefully we can harness all that good and carry it forward as we serve our patients.
Absolutely. I think everyone was reminded in the past 2 years of how important our healthcare providers are. And we couldn't have gotten this far without them, certainly.
Thank you.
Thanks, Redonda.
Thank you so much.
Thank you, Redonda and Carley. Here's a few more of this year's Leaders in Healthcare honorees.
The Healthcare Executive Non-Hospital category. Bernard J.B. Foster was born in Germany, moved to Ghana with his single mother, and then 12 years later moved to New York, where he ended up homeless for a time. He raised a brother and sister and joined the Army National Guard. He hasn't let such obstacles get in the way of his mission to help those suffering from drug and alcohol abuse. He now leads Turk House, a treatment center that today serves 300 patients per day. Please congratulate Bernard J.B. Foster, Executive Director of Turk House.
Hello, my name is Bernard J.B. Foster. I am the Executive Director of Turk House, Inc., a behavioral treatment facility. First and foremost, I just want to thank the Baltimore Business Journal for recognizing and choosing me as one of the leaders in healthcare for 2021. I just want to say thank you for the recognition. I also want to interject that this is a recognition that I do not share by myself, but the Turk House apparatus and team who have gone above and beyond to ensure that in the midst of a debilitating pandemic, our doors were kept open. And so this is to the whole Turk House. I received this on behalf of the whole Turk House agency, the staff, board of directors, partners, volunteers, and donors. So once again, just want to thank you, and I'll see you guys soon. Thank you so much.
You can now get one-day Amazon delivery of COVID test kits that let you read results on your phones. Dave Hickey had a lot to do with that. He has helped steer BD's development, launch, manufacturing, and distribution of point-of-care tests. He says COVID-19 also made clear the need for diagnostic services in non-traditional settings. Please congratulate Dave Hickey, Executive Vice President and President of BD Life Sciences.
I am absolutely delighted to be named among the Baltimore Business Journal Leaders in Healthcare. And to say that 2021 was a challenge for the healthcare industry is, of course, an understatement. BD was and continues to be at the forefront of COVID-19 testing. Our PCR tests, swabs, and rapid antigen point-of-care tests have been making a difference here in Maryland and around the world. And so as I gratefully accept this award, I want to acknowledge that my ability to be a leader in healthcare is because of the people that I have the privilege to lead. The teams on our Sparks campus include R&D, as well as manufacturing and distribution. These essential workers have demonstrated incredible commitment to making sure our customers and the patients are able to do their important work. So as I say thank you to BBJ for this award, I also want to say thank you to our BD associates. Thank you for helping advance the world of health.
Shirley Sutton said she has seen many community members and loved ones in her own family suffer needlessly due to the lack of access to health care. She decided her life work would be to change that. Sutton's career path took several twists and turns before she landed the top job at Baltimore Medical System, where she is leading the nonprofit's push for social services and giving. Please congratulate Shirley Sutton, CEO, Baltimore Medical System.
Thank you for this award. I really appreciate it. It's an honor, and I'm also so excited that Baltimore Medical System has allowed me to get this recognition, and that you appreciate the work of community health. I could not have done it without my unstoppable staff at BMS and board of directors who have put forth the support that I've needed to continue to move the organization forward. Again, thank you so much. And to the other honorees, congratulations. I'm proud to be among you.
Congratulations to Dave Hickey, Bernard J.B. Foster, and Shirley Sutton. Now for our final fireside chat of the program, I'd like to introduce BBJ Managing Editor Jess Ianetta for her discussion with President, MNA, and Professor with Coppin State University College of Health Professions, Charlotte Wood. Jess.
Thank you, Rhonda. Healthcare has faced enormous challenges over the past 2 years amid the pandemic, and nurses have been on the front lines as the industry has changed and adapted. Here with me today is Charlotte Wood, who is president of the Maryland Nurses Association and a professor at Coppin State University's College of Health Professions. Thank you for being here, Charlotte.
Well, thank you for having me. It's my pleasure to be here with you.
Great. So I'd like to just start off by asking you, what has it been like to lead the Maryland Nurses Association over the last 2 years amid the pandemic?
It's been quite an interesting journey. I'd like to just simply share with you that it has started out as quite the challenge, and we were able to look at our strategic plan, and based on our strategic plan, there were some very specific tasks that nurses wanted to be able to see over the course of the next 2 years. So our challenge was to move what we thought we were going to be doing in a face-to-face environment to a virtual environment. And believe it or not, we were able to accomplish having a higher level of engagement because those people that are in rural areas or areas that we could not access, or they had issues with driving into our meetings or our activities, they actually were better able to participate. So it really moved us to a higher level of engagement. We actually had events, social gatherings, and educational initiatives. And in fact, we had several new opportunities, one being our virtual convention.
There has been a lot in the news lately about nursing shortages, both in Maryland and across the country. And obviously, this has been an issue before the pandemic as well. But what do you think needs to be done to better address this issue?
Thank you for that question. As a matter of fact, it's a very critical question because it's a question that has existed over time because nursing shortages are very cyclic. And one of the things that happens when we have a nursing shortage is that there are multiple variables that contribute and impact how nurses move in and out of the profession. This is the first time that we've had the opportunity to have a nursing shortage and have nurses have to work and perform during the pandemic. So we believe that a collaborative of leaders across the nation and in particular states across the state to look at long-term initiatives that will help prevent the shortage of nurses. And a couple of quick strategies might be, one, increasing the amount of diversity that we see in nursing. Nursing is a profession that has a multitude of individuals from across many diverse cultures and ethnic groups, and we need more of those. In addition to that, one of the key items that we could really use more of is men in our profession. If there were as many men in the profession of nursing as there are women, we would not have a nursing shortage. So those are some of the things we need to be able to do.
Absolutely. And obviously some of the labor shortage we're seeing are not limited to nursing. And I know that some of the shortages we've seen can also impact nurses, other positions at hospitals. Can you talk a little bit about that?
Oh, absolutely. The shortage does not singly tackle the issues of nurses themselves. There are issues relative to housekeeping. There are issues relative to other professionals, such as physical therapists, occupational therapists, and other practitioners who are a part of the collaborative workforce in healthcare that impact whether or not the nursing shortage is as impactful as it is today. So you can have a nursing shortage without having a shortage of those others, and it won't be quite as intense. But when you have other members of the healthcare team, other interdisciplinary colleagues, that's when we move into an environment where nurses tend to have an increased level of responsibility that is not typically a part of their role.
Right. And that's something that can maybe lead to burnout, which is something we've also, has also been talked about a lot, in the healthcare profession and nursing in particular. Are there any specific steps you think need to be taken to address burnout among nurses?
Well, as you well know, the stress and the issue of nursing burnout has been around for years. And it's not necessarily because of the pandemic, but the pandemic has exacerbated some of the issues relative to burnout, the stress and the frustration that many of my colleagues feel in the profession. I would venture to say that one of the really huge things that needs to happen now and moving forward into the future is that leaders in healthcare and leaders across our nation need to really be able to understand and recognize burnout and the frustration and the issues that go along with burnout. We also need to think about considering putting in place some long-term initiatives and strategies that would assist nurses in being able to have therapeutic activities both on the job and external to their job, as well as providing some downtime to encourage nurses to increase their wellness and their well-being for work and have a work-life balance.
Absolutely. Yeah. And you're kind of in a unique position because you are president of Maryland Nurses Association. So you have that frontline perspective, but you're also a professor at Coppin. So you're kind of seeing the people, coming into the industry. So sort of from the professor perspective, have you seen that the pandemic has affected the number of students that are interested in nursing, or maybe the types of students that are interested in nursing?
Initially, we did see, and I think when I say we did see, I think globally and more in terms of individuals across other schools of nursing, there were more individuals who came into and wanted to be a part of the nursing profession. It's sort of tapered off now because, of course, the pandemic has caused some individuals to be a bit concerned about being a part of a workforce that has to deal with the sickest members of our society. However, I think there are still a tremendously large number of individuals who have a passion, a desire, and even a commitment to want to be a nurse to help facilitate the well-being of not only their personal family, but their community, and how they can have outreach and touch others who don't have access to healthcare. So we've seen some significant headways with different individuals, and I think we will eventually see an increase in the number of individuals who want to get into healthcare. Our biggest issue with that is going to be we don't have enough nurse educators to be able to help facilitate that growth in our profession. So we need to move towards increasing the number of nurse educators to help facilitate the number of new individuals interested in nursing.
Yes, definitely. And now switching gears a little bit, I know that you've been working in the community and doing a lot of good work around vaccinations, earlier in the pandemic and continuing. And I just want to know if you could talk a little bit about that and also what lessons you have taken away from that work.
Well, I thank you for asking that question, because we still are fighting the good fight with ensuring that people do all the right things with how they protect themselves relative to the pandemic and relative to working in the community. Working on a task force to help to facilitate looking at what was happening in our communities and how we get the word out about the pandemic was really a rewarding activity to ensure that people that didn't normally have access to healthcare was able to gain it. Assisting with an individual project that looked at utilizing telehealth and utilizing a mechanism of outreach to members that did not have access to healthcare to get their vaccinations. We use faith-based initiatives to do that. So there were several opportunities for us to connect with the community to ensure that they got their vaccinations by working through people that they most trusted, which they should be relying on those individuals as well as the people who have the education to help facilitate the understanding about getting vaccinations. So yes, we did vaccination clinics for all of January, February, and March. We've done periodic ones since then. And we've also put out literature, and we've tried to assist with furthering the initiatives associated with the pandemic and vaccinations and how one should care for themselves during this pandemic by connecting with members, not only within the community, but within the larger community, such as we're doing today. We did a couple of public service announcements. So all of those things make a difference in our society.
And finally, I wanted to ask, what is one thing you wish people outside the profession understood about nursing and being a nurse?
Well, that is a loaded question. And so I really appreciate it because I am so passionate about my profession and about my desire and my love of nursing. And although every nurse does not necessarily have the love and the commitment that I have, many of them do. And I just want you to know that nursing is a profession that's considered the most ethical profession in the United States. And we want everyone to be able to know that if there's any way that you can help nurses, particularly as we move through what's left of this pandemic, and as it morphs into a component of our normal lives, let's do the best we can do in terms of being able to wear masks when we're supposed to, wash our hands when we're supposed to, socially distance appropriately, because we don't know whether this particular organism or COVID-19 is going to be with us for the rest of the time. It might be our new normal. So nurses need to be able to be relieved if people get vaccinated of some of the burden that's associated with the multitude of individuals they're seeing that come into the hospital unvaccinated. So let's protect ourselves. Let's protect others. Let's make sure that we do as best we can for this wonderful profession that I love so much, to stay alive and well and continue to take care of the members of our country.
Definitely. Always a great reminder. Thank you so much for your time today, Charlotte.
Oh, you are so welcome, Jess. Thank you for having me.
Thank you, Charlotte and Jess. And now for our last group of leaders and healthcare honorees.
The Healthcare Outcomes category. This honoree spent time shadowing a family friend and pharmacist in her native Iran. It was then she decided the field was for her, and she's never looked back. She now leads pharmacy services at Chase Brexton, an organization dedicated to helping serve the most vulnerable citizens. Congratulations to Dr. Maru Hershadi, Vice President of Pharmacy Services at Chase Brexton Healthcare.
Hello, everyone. I'm deeply honored to have been selected as one of the Baltimore business leaders for 2021. I'm sincerely grateful for the recognitions from the program sponsor. I should admit I was a bit stunned when I learned about my nominations. Without false modesty, I feel that other leaders are also worthy of this reward. However, I do realize that it cannot be divided into many. So again, I want to express my gratitude to you. I am very pleased to receive this reward. My main reason for joining Chase Brexton Health Center was due to my passion for serving communities of need. And I must admit that this organization has given me that opportunity. Our mission is what energizes me and motivates me to give more every single day. The fight against COVID-19 and saving lives of most vulnerable populations in Baltimore and surrounding counties has taught me to be selfless, humble, and pivot quickly when needed, which in turn allowed me to bring the best of me to this organization and to the communities that we serve. I would like to give my sincere appreciation to everyone I work with every day who are passionate about the work that they do, which makes our organizations successful. I also want to express my sincere gratitude to my family, which supported me in all my undertaking. I'm very pleased to have received this award. Thank you for your choice and for your trust in me. I will do my best to justify your trust and to further contribute to the communities that we serve. Thank you.
Dr. Mona Gahunia has been on the front line of the effort to get people vaccinated against the COVID-19 virus. She has taken to the airwaves, letting people know she's a mom who trusts the vaccine for her own children. She's not giving up and says vaccine messaging is key to stopping the pandemic. Please congratulate Dr. Mona Gahunia, Associate Medical Director of Kaiser Permanente.
Hi, I'm Mona Gahunia, infectious disease physician and associate medical director with Kaiser Permanente Mid-Atlantic. And I want to thank the Baltimore Business Journal for this incredible recognition. I would not have been able to achieve this without the support of the many physicians and leaders within the Mid-Atlantic Permanente Medical Group, over 1,700, especially my primary care and infectious disease colleagues. And I also want to thank the Maryland Department of Health, as well as the countless community partners in the city of Baltimore who worked together to bring COVID vaccine outreach, education, and dispel misinformation and improve access to care for communities that needed it the most. That's the work that I remain most proud of. And I want to thank my family, of course, whose unwavering support was critical during the entire pandemic, especially my husband and my two sons, Nishant and Akash. And I just want to remind you to go get vaccinated if there's some chance you haven't yet. If you haven't gotten your booster yet and you're eligible, please do that. And please get your flu shot. It's more important than ever. Thank you.
The Senior Care category. Before coming to Maryland, our next honoree turned around a struggling hospital in Minnesota. The effort earned her a spot on Minnesota's 100 Influential Healthcare Leaders. She continues to earn recognition for her work at LifeBridge Health Slevendale, where she has made upgrading aging facilities a priority. Please congratulate Deborah Graves, President, Levendale Hospital.
Thank you. I am so honored to be recognized as a 2021 Leader in Healthcare. I would like to thank the Baltimore Business Journal for this wonderful recognition, as well as congratulate this year's other honorees. In healthcare, we are truly a community, and we have seen this community come together in response to extraordinary challenges. I would like to thank my wife and family for their love, as well as share my appreciation for the support of the larger LifeBridge Health family. At Levendale, We have the privilege of taking care of people over an extended time. Whether it's a coma stimulation program, complex care, acute rehab, brain health, skilled rehab, or long-term care, we develop close connections. And our team members see our patients and residents as family. I am so proud to lead the amazing team at Levendale who care bravely and who bring hope, health, and healing to all those we serve. Finally, I'd like to share a message that I often share with our staff at Levendale. Be kind, speak truth, show grace, work hard, have courage, be grateful. I am grateful for you and the work that we all do every day. Thank you.
This honoree has helped oversee the completion of an $80 million master plan at Broadmead, a Hunt Valley Life Plan community. The work, which includes a lake observation deck, walking paths, new dining rooms, new homes, and renovated activity space, began in 2015. But her plans for the community go well beyond the physical space. She is working on programs to improve the health and well-being of her residents. Please congratulate Robin Summers, President and CEO of Broadmead, Inc.
Hello, I'm Robin Summers, President and CEO of the Broadmead community. I am honored to be selected as one of the Baltimore Business Journal's 2021 Leaders in Healthcare, and to share this recognition with such an esteemed group of other healthcare leaders. 2021 has undoubtedly been a challenging year for all healthcare leaders in Baltimore. I would like to thank Marie Hartman of Hartman Executive Advisors for her nomination. I also want to thank my colleagues who serve beside me as Broadmead's executive team, our leadership team, and my wonderful Broadmead coworkers for their unwavering support and dedication. Finally, thank you to the Baltimore Business Journal for your generous recognition of Baltimore's healthcare leaders. Thank you.
Congratulations to Dr. Maru Hashadi, Dr. Mona Gahunia, Robin Summers, and Deborah Graves. Congratulations again to all of the 2021 Leaders in Healthcare honorees. Thank you to all of today's panelists for sharing your healthcare industry insights and experiences with all of us today. You'll learn more about our honorees in tomorrow's December 10th issue of the Baltimore Business Journal. That concludes the Baltimore Business Journal's Leaders in Healthcare Awards and discussion. I would like to thank our sponsors and all of you who are on the front lines of this pandemic, either in the hospitals or supporting those who are. Thank you. Thank you for joining us and have a great rest of your day.